Good afternoon, everyone. I am Chavez Aimian Claire, and I am with Burano Alden Hill, Cadiz Julia Alexandra, Mabesa Shamir May, and Mencias Marco to discuss antisocial personality disorder. I am here to give a quick overview of what is antisocial personality disorder. Imagine someone who doesn't seem to care about the rules or the feelings of others. That's a glimpse into antisocial disorder. It is a condition where people often struggle with empathy, impulse control, and following societal norms. People with antisocial personality disorder, or ASPD, can be witty, charming, and fun to be around, but they can also lie and exploit others. People with ASPD appear uncaring and don't show remorse for their actions. Someone with the disorder may act rashly, destructive, and unsafely without feeling guilty when their actions hurt other people. Antisocial personality disorder can be divided into two main subtypes. Psychopathy. It is individuals who are often calculated, manipulative, and lack genuine empathy. They can often be very charming and persuasive. They often have a superficial charm that can mask their underlying disregard for others. While the other is sociopathy, sociopathy also disregards social rules. They may have a strong capacity for forming attachment. They tend to be more impulsive and easily angered than sociopaths. They may also be more likely to engage in reckless or impulsive behavior. ASPD, or antisocial personality disorder, affects a small percentage of the population, estimated to be between 2% and 4%, and it is more common in men than in women.
Thank you, Ms. Chavez. Hello, my name is Alden Burano, and I'm here to discuss the symptoms of ASPD. To be diagnosed with ASPD, an individual must meet specific criteria laid out in the DSM-5, which is the diagnostic manual used by mental health professionals. Let's break this down. First, the person must show a pervasive pattern of disregard for and violation of the rights of others, and this pattern must have started since the age of 15. To confirm the diagnosis, at least three of the following behaviors need to be present. The first criteria is a failure to conform to social norms, particularly with respect to lawful behavior. This means the person repeatedly engages in actions that can lead to arrest, or gumagawa sila ng mga bagay na pwede sila makulong. They tend to commit criminal acts without much concern for the consequences. Second, there is deceitfulness. This involves lying repeatedly, using fake identities or aliases, or conning others for personal gain or pleasure. Their behavior often revolves around manipulating people without feeling guilty about it. Third is impulsivity or a failure to plan ahead. These individuals tend to act without thinking of the future or the consequences, leading to risky or erratic decisions. Fourth, they may show irritability and aggressiveness. This is often evident through repeated physical fights or assaults. They have trouble controlling their anger and are quick to resort to violence. Fifth, there is reckless disregard for the safety of themselves or others. They take unnecessary risks and it doesn't bother them if their actions put others in danger. Six is that they exhibit consistent irresponsibility. This means failing to maintain steady work or not fulfilling financial responsibilities, like constantly skipping bills or abandoning job commitments. And seventh, a lack of remorse. These individuals often show no guilt or empathy for their harmful behaviors. They might rationalize, minimize, or even dismiss the fact that they hurt others, stole from them, or mistreated them in some way. Now, beyond these behaviors, there are few other important points to keep in mind for a diagnosis. The individual must be at least 18 years old. There also needs to be evidence that they had a conduct disorder before the age of 15. Conduct disorder in children or adolescents can include aggressive behavior, destruction of property, or serious violations of rules. Lastly, it's essential to rule out that the antisocial behavior is not solely occurring during an episode of schizophrenia or bipolar disorder. People with ASPD tend to have a hard time maintaining healthy relationships, including friendships and romantic partnerships. Many have a history of numerous sexual partners and struggle to sustain monogamous relationships. They may also be irresponsible as parents, neglecting their children's needs or abandoning parental duties. Their behavior can also affect their ability to keep a steady job. Their impulsivity, irresponsibility, and disregard for others make it challenging to maintain consistent employment. It's also important to highlight that research suggests people with personality disorders, including ASPD, are at a higher risk of attempting suicide compared to the general population. The impulsive nature of ASPD, combined with the feelings of emptiness or frustration, can lead individuals towards self-destructive behaviors.
Causes and risk factors. So the causes and risk factors. First, the personality is the unique combination of thoughts, emotion, and behaviors that distinguishes each individual, and it shapes how people perceive, understand, and engage with the external world, as well as how they view themselves. So, forming during early childhood, personality is influenced by both genetic factors and life experiences. So, the plausible causes of ASPD is that genetic factors can increase susceptibility to developing antisocial personality disorder, while environmental influences, particularly with neglect and abuse, may contribute to its onset. And alterations in brain function may have occurred during its developmental stages. And the risk factors are diagnosis of childhood conduct disorder, family history, antisocial personality disorder, or other personality disorders or mental health conditions, experiencing abuse or neglect during childhood, unstable or violent family life during childhood.
Good afternoon. My name is Marco Mencias, and I'll be discussing about the management and support for antisocial personality disorder. First is the psychotherapy, specifically the cognitive behavior therapy. This a treatment that aims to address maladaptive behaviors and patterns of thoughts of a person. Uh, this treatment will help the antisocial personality disorder by changing the way of thinking of a person and behavior of a person. Second is medications. May address particular symptoms and conditions. Me- Medications can help to manage the symptoms of antisocial personality disorder, but there is no specific treatment or medication for antisocial personality disorder. And third is journaling. Journaling will help uh, the person to self-reflect about his thoughts, about his perspective, and it will help him to improve himself. And fourth is relaxation and stress management. Meditation can help to process behavior, like doing yoga, exercise, and calm exercises that will help you to stimulate a positive emotions. Last but not the least is support group. People with the same kind of condition can help each other to cope up. Joining a support group will help the person to process to process his behavior, and also to and also it will help him to relate himself about others also, about about having the same condition.
Yan. Thank you po for listening to
That's it
our
for the management and
presentation
support.
about
Thank you.
antisocial personality disorder. And we hope na may natutunan po kayo. And of course, to check yung knowledge na nagather nyo tungkol sa presentation namin, meron po kaming mini quiz lang naman. So we have here 6 items for you to answer. 2 questions for multiple choice, 2 for true or false, and last 2 for fill in the blanks. Pay attention to the quiz questions and just type your answer in the comment section na lang po. So we will proceed to question number 1. So you have 15 seconds to answer each question po. So the answer is letter C, antisocial personality disorder. So people with antisocial personality disorder appear uncaring and don't show remorse for their actions. So next question. So the answer is 4. So meron po tayong 4 na criterion for ASPD or antisocial personality disorder, of which criterion A has 7 sub-features. So in criterion A, we have a pervasive pattern of disregard for and violation of the rights of others occurring since 15 years old, as indicated by 3 or more of the following. Ayan na po yung sub-features. So criterion B is the individual is at least age 18 years, and criterion C is there is evidence of conduct disorder with onset before age 15 years. And criterion D is the occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. So next question po, we have true or false. So, again, type nyo lang po yung answer nyo sa comment section. Ayan, so the answer po is true. Genetic factors can increase susceptibility to developing antisocial personality disorder, while environmental influences, particularly with neglect and abuse, may contribute to its onset. So next question. True po ulit. So antisocial personality disorder is 3 times as common in men than in women. So let's proceed naman sa fill in the blank. So again, just type nyo lang po sa comment section yung answer ninyo. The answer is cognitive behavior therapy or CBT. So for the last question, answer is conduct disorder. It was present by history before age 15. So conduct disorder involves a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate societal norms or rules are violated. So thank you po for participating sa aming mini quiz. So I hope and sana po may natutunan kayo sa presentation namin. And again, thank you.